Hello, I'm Mark Bendon. I'm coming to you live and in person from the Ergonomics Center here at Texas A&M's Health Science Center School of Public Health. The Ambicycle is a rescue vehicle designed to evacuate patients from rural areas, particularly in developing nations where the access to 911 emergency services is very limited. In the U.S., it'd be very difficult for us to understand a concept where we might put someone on a motorcycle to evacuate them or to rescue them. But in a developing area where it's difficult to get vehicles through traffic, the roads are very congested, really 24 hours a day, having something small and nimble, this is only 36 inches wide, that can navigate very tight streets and corners, especially in areas where there is a lot of congestion but not a lot of developed healthcare like we're used to with ambulance service. This could be a very important vehicle to help those areas to develop. So it's something we have begun commercializing. We do have the patent on it, and we are seeking commercial partners to take it to the world and to help others to get the medical care that they need. The patient would lie beneath the driver where they can maintain full contact, full access, and probably most important for the patient, they can communicate verbally and be reassured. We have developed some models of this where we have devices inside of the helmet for the medic that communicate with the vital signs of the patient to allow the medic to stay in constant contact with any problems that the patient may be incurring and to know when to stop and render aid. But in most cases, the developing world is looking at these to transport someone for maybe OB well care, perhaps to go and get kidney dialysis or an AIDS treatment. Not the type of thing we're used to in the US for trauma and car crashes and those sort of things. This is just a way to get people to healthcare that otherwise would not be able to make the trip. There are many different applications, including civilian and military. One of the potential uses for an EMS type system is to put a couple of these on a helicopter, send the helicopter out to the scene of a trauma, maybe a mass casualty situation, could be a nuclear, biological, chemical attack, and deploy either drone operated, which would be remotely operated ambicycles, or a medic driven person operated ambicycle to the scene where they can retrieve the patients and bring them back to the helicopter landing zone and then have the helicopter transport them to a higher level of care. So unfortunately, when a lot of these larger events occur, the most difficult thing is getting treatment in to where the patients are hurt, and then of course evacuating the patients out. And this is a potential way to help solve some of those problems.